I guess from my perspective, so I have a son with hemophilia and I had a dad with hemophilia. And so looking at a lifespan, going back decades of what does access to treatment and care look like in a very expensive disease. So with the onset of federal changes, for example, the ACA, the Affordable Care Act, while people may dislike or like certain parts of that, what it did for our population was made sure that we had access to expensive therapies. So for example, prior to the ACA, you would reach your lifetime cap in hemophilia by the time your severe son with hemophilia A was 5 or 6 years old. Lifetime cap. What does that mean for the family? That means you would have to change jobs. If that wasn't a possibility, you might have to get divorced. You may have to, and those were things that people were recommending for these rare disease families with super high cost medicines. Once the federal government started looking at the gaps in coverage of these expensive diseases, it really opened up the possibility of coverage for every family. And certainly nothing is perfect, but it really did allow for no discrimination against pre-existing conditions, keeping your children on your policy until they're 26 years old, which helped in that college and then first job gap, that you wouldn't drop off in insurance. And especially if you have a rare disease that's life-threatening, if you don't have your medicine, then that allowed you to be able to go from young adult to prosperous young adult, So I think that some of those advancements and acknowledgments by the federal healthcare system have been crucial for keeping our population healthy and able to be productive citizens. So that's really a big change in the last several years.